Senator Bob Menendez, Democrat from New Jersey, joins us now. Senator Menendez, is this all but assured that this thing will pass tomorrow?
I believe it will pass undoubtedly. It needs now only 51 votes, and it'll be good for the country and getting people back to work, from letting small businesses be able to buy equipment they desperately need and write it off in the same year. Everybody who creates that equipment, delivers it, installs it, be put back to work, to giving small businesses and other companies the opportunity, if they hire someone, to forego the payroll tax and then get a $1,000 tax credit at the end of a year of continuous employment for that individual, to expanding for a year the highway transportation fund that will put people to work across projects across this country. So it is a great bill. We're glad to have had bipartisan support to move it forward, break the filibuster, and put people back to work in this country.
On health care, there's the big summit with congressional leaders and President Obama later this week. You are now the 20th Democratic senator to sign a letter in support of the public option, of passing the public option through a filibuster. But Senator Rockefeller, Democrat from West Virginia, one of the stalwart supporters also of the public option, he told TalkingPointsMemo.com last night, quote, "I'm probably not going to vote for that. I don't think the timing of it is very good. I think the timing of the public option piece of legislation, which is not in what the president's going to suggest at the summit, I think doing that could create a lot of turbulence when we don't need it." Is he wrong?
Well, no, I respect Senator Rockefeller. He's been a strong proponent of the public option, as I have. We just simply want to have a vote on the public option. I understand why the president didn't put it in his proposal, because it didn't pass the Senate as the health care bill passed. So he wanted to keep the possibility of bridging the differences between the House and the Senate and create a platform for Republicans to offer their ideas this Thursday and hopefully move forward. So, but just simply having a vote on a public option is not, I think, the turbulence that will derail any effort to ultimately have the type of health care reform that reduces costs, stops insurance company abuses against consumers, and ensures more Americans.
But when I look at the math, Senator, as I'm sure you could probably look at it as well, I still don't see the 51 Democratic votes for the public option. When you peel away the centrists who are outright against it, as well as those who are on the fence, it still seems like you're short of the 51, even if you wanted to try to vote on it through reconciliation.
Well, you know, there's an effort, there's a continuous momentum building, and there's a lot more people who I believe will join. And I think that at a certain point, when you get to a certain number, there's a tipping point. And people who may have felt that it is not possible, may feel it's possible. It's a tremendous element of controlling costs. It's very well determined that it would help control costs against a wide array of private insurance companies that would be part of the exchange. So I just think that it's something that we should keep alive, and the possibility of it moving forward. And so that's why many of us have signed a letter to the majority leader to, if we move through the process of reconciliation, give us a vote on it.
Democratic Senator Bob Menendez of New Jersey. Senator, thanks for joining us today.
Good to be with you, Dan.